My name is Kirk Hamilton, your host of the Staying Healthy Today show. And this is a show where we make commentary on and interview different aspects of health. And I'm going to start off by saying I haven't been doing this show since May of 2024, just before COVID really got going. And I started treating early COVID. And so a lot of things have transpired since then. And one of the things I wanted to share today was uh, a experience I had. I was admitted to an emergency room with acute abdominal pain and nausea. I have colon cancer, and so I've had some gastrointestinal symptoms on the side. The big concern, since I haven't done surgery and then chemo, I've been trying some what I would say is alternative therapies, such as repurposed drugs, IV vitamin C, nutraceuticals, and diet change. But in this case, the concern is because of where the tumor is, and it's been over a year since it's been diagnosed, is that you don't want to have a case where you have an intestinal blockage that can be an acute emergency. So, with that said, having some acute abdominal pain that I hadn't had before in this degree, and nausea, I went to the emergency room, and there I just had difficulty standing up. I could not get in any comfortable position. The pain was excruciating across my upper abdomen. And this went on in the emergency room, getting there about 12:30 and leaving about 10:30 at night, um, and trying to get appropriate pain medication and then the appropriate blood work and CT scan to find out if, in fact, I had ruptured or had a blockage in my intestine. To make a long story short, uh, after finally getting some IV medication dilaudid and some IV Zofran, I had some immediate relief in my abdominal pain. This is probably, I don't know, 3 or 4 hours into the event, and but then it returned quickly when I moved, and so I had to get a CT scan. Then we had to wait for the results of those for another couple hours, and again I got the dilaudid and I believe Zofran intravenously, and then I was totally at peace. I could stay on a gurney, and it didn't come back. And I meditated for about 3 hours, two of my favorite meditations, put my headphones on. And to make a long story short, I eventually was released from the hospital. They felt it was a kidney stone, not my colon cancer creating intestinal blockage. And I would be go home and observed and then follow up with a GI surgeon later to discuss my CT scan. But since I've been on quite a journey of doing a variety of diets over the last year and using repurposed drugs for to try to treat the cancer and taking a few supplements, I've never thought of having a kidney stone. In fact, it wasn't even in my consciousness. And so when I look back, one of the things I did, what I have been doing, obviously, is taking high dose vitamin C intravenously, about 50 grams 3 or 4 times a week. There is some concern that uh, oxalate is a metabolite of vitamin C in the body, and that might increase the risk of kidney stones. So we've never observed it, and I've been doing this for over a year. But at the same time, for the last 2 weeks, I had been doing 70 ounces of a 75-25 green smoothie, which is 75% greens, packed greens, and 25% some fruit. Um, and I happened to choose, I looked at the package, the two highest oxalate containing greens in the package. I was getting spinach, which is the highest, and then chard, which is very high, and then kale, which is much lower, but those were in there. And the point was is that maybe I wasn't drinking enough fluid, along with the intense drinking of this smoothie. I mean, 70 ounces, that's 3 24-ounce, 3.5 24-ounce Stanley thermoses a day, along with possibly restricting my fluid intake and the IV vitamin C, perfect storm to create the kidney stone. So uh, I don't fear having kidney stones, but the lesson is that we always can learn after the fact. And so stepping back and looking at, I'll have greens, I'll have green smoothies, but I might not use the same mixture. I'll make sure I'm drinking more fluid. And we just need to pay attention. And sometimes the best teacher is hindsight. So my name is Kirk Hamilton, the Staying Healthy Today show, and you are welcome to make any comment you wish. And I hope you have a great day and learn something. So to avoid kidney stones, stay on a lower animal protein diet than a higher animal protein diet. Make sure you aren't consuming massive quantities of oxalate containing greens, because calcium oxalate stones are the highest, are the most common kidney stones. Stay off high salt diet, stay off a high sugar diet, drink lots of fluids because the stone has to precipitate. Okay, so I hope you have a great day and talk to you soon.